Hello, my name is Dashel Sandals, and thank you for viewing my poster. My research explores an important question. Do Black men's perceptions of their physical and mental health risks align with what we see in electronic health records? Understanding this alignment or misalignment is essential for improving health outcomes and reducing long-standing disparities. Some background for you. Black men in the United States face disproportionately high rates of chronic disease, mental health challenges, and premature mortality. These disparities are shaped by limited access to care, stigma around help seeking, and financial and psychosocial stressors. Despite elevated risk, Black men remain underrepresented in clinical trials and preventive health programs. Our study aims to better understand how Black men view their own health and how those perceptions compare to objective initial data. The goal of this project is twofold. One, identify gaps between self perceived health risks and actual diagnoses, and two, engage Black men in strategies that increase awareness, preventive care, and participation in research. This work lays the foundation for culturally grounded interventions that can improve early detection and long term health outcomes. Now, onto our methods. To collect Black men's perspectives, we surveyed nearly 100 Black men ages 18 and older, primarily from the Gulf Coast region. Participants were recruited from barbershops, churches, health fairs, social clubs, and sporting events such as the Bayou Classic. The electronic survey assessed knowledge of chronic disease risk, mental health perceptions and care seeking, and willingness to participate in clinical research. Some of the key findings for physical health were that participants showed high awareness of major chronic disease risks. 47.2% reported a hypertension diagnosis, and 26.9% reported a diabetes diagnosis. Age and hypertension were significantly correlated. However, only 7.4% of participants reported a cardiovascular disease diagnosis, far below the national prevalence of about 60%. Even among men aged 55 and older, only 10% reported CVD. This suggests a potential gap between perceived health, actual risk, and possibly underdiagnosis or delayed detection. Now, for our survey responses for mental health, we found that mental health care was also significantly underutilized. In fact, 83% reported no mental health diagnosis, and 64.8% had never sought therapy. Participants cited barriers such as cost, time required to find appropriate care, lack of trust, and concerns about confidentiality. These findings mirror national trends showing that Black men underuse mental health services despite high exposure to stressors. Now, interpreting this, across both physical and mental health, self-reported diagnoses were lower than expected. This mismatch may reflect limited engagement with healthcare, underdiagnosis, gaps in awareness, and structural barriers to care. These insights highlight the need for targeted, culturally informed strategies to improve preventative care and early detection. Now, the next phase of our project compared these survey findings with electronic health record data from Black men in the same demographic. We will examine frequency of healthcare encounters, use of preventive and mental health services, chronic disease diagnoses and severity, screening adherence, points of entry into the healthcare system. And this integrated approach will guide focus groups and help develop community-driven interventions that resonate with Black men's lived experiences. Now, in closing, by comparing Black men's perspectives with clinical data, this research aims to illuminate the factors contributing to delayed diagnosis and underutilization of care among Black men. Ultimately, our goal is to support interventions that improve awareness, increase engagement, and advance health equity. Thank you for watching, and I welcome your questions or feedback.